kindly message me. There will be some problem in getting my videos today. I mean my camera video. Okay, if you are getting my videos properly, please tell me. Okay, okay. Anju is telling yes. Udit is telling yes. Good morning, Udit Dash. Good morning. Okay, so you people are getting my videos properly. I mean the screen you are getting properly. Okay. Next class you will be getting properly my camera also. Today we have some technical issues. That's why. Okay. Today we will discuss again some of the important topics or questions. So the first question is a a pediatric patient has been diagnosed with a right lower lobe pneumonia. A right lower lobe pneumonia. Upon auscultation of this lung field, the nurse should expect to hear which breath sound. So this is regarding breath sound. This is regarding breath sound. So options I have given here: crackles, wheezes, stridor, and rhonchi. I can tell you, before I told you some important topics, or I told you some core point discussion. So one of the important thing is that you should know different type of breath sound, different type of normal and abnormal breath sound. I'm not telling you to study it in a detailed manner, but at least some idea you should have regarding breath sound, because many times questions have asked from this topic. Okay, so pediatric patient has been diagnosed with a right lower lobe pneumonia. Okay, so it's a pneumonia. In pneumonia, what type of breath sound you can hear? Okay, in pneumonia, what type of breath sound we can hear? Or are giving answer D, rhonchi, right side lobar pneumonia. So you can give your answer, no problem. So the thing is that you have to understand the concept of a breath sound. Okay, you have to understand the concept of breath sound. So crackles, what is crackles? What is wheezes? What is stridor? Then what is rhonchi? All those things. Okay. So the answer will be A. Answer will be A. It's crackles. Answer will be A, crackles. Let's see. Let's see. Okay. We'll see normal breath sound. So one by one we will study. One by one we will study. We will study the important things. So today we are going to learn about normal breath sounds. Okay. Okay. Now I am telling you normal sounds. Normal breath sound I am going to tell you. Okay. First one is a tracheal breath sound. Tracheal breath sound. So this is a normal breath sound. Just understand the words or different type of sounds. Okay, so first one is tracheal breath sound. It's a normal sound. Okay, tracheal breath sound, and you can hear this breath sound over trachea. So when you put this stethoscope over trachea, there you can see tracheal breath sound. Tracheal breath sound you can hear there. Okay, tracheal breath sound. You got it? So very easy, tracheal breath sound. So you can hear it on trachea. Okay. In which condition, where, or where you have to place the stethoscope, it's on detailed things. No need now. Tracheal breath sound can be heard over trachea. Tracheal breath sound is a normal breath sound. Okay. So vesicular breath sound. This is the major normal breath sound. Vesicular breath sound is one of the normal breath sound, and this is the major breath sound. Okay, means you can hear almost all over the lungs. You can hear this sound, vesicular breath sound. Now you may be having doubt like how it would be this vesicular breath sound, how it will be a tracheal. So if you start to study this one, it will take more time. It is more deep, like inspiration, how the pitch will be, or expiration, how the pitch will be. No need to go that much on deep. This is a normal breath sound. So vesicular breath sound, when you hear, you have to understand it's a normal breath sound, and vesicular breath sound is the major sound that you can hear almost all over the lungs. Next sound is bronchial breath sound. So this is the third sound, bronchial breath sound. So bronchial breath sound, normally this sound you can heard anywhere, like other than if these sounds are heard anywhere other than over the manubrium. So normally you can hear this sound on manubrium, but if you hear this sound any other place, so no, if you hear this sound on manubrium, bronchial breath sounds are normal. But if you hear this bronchial breath sounds any another place, it is an indication that consolidation exists. Consolidation means what? Consolidation means nothing. Normally there will be spaces where air is filled. In your lungs there are spaces where air is filled. In that space now fluid is accumulated. That is called as consolidation. So bronchial breath sound normally you can hear on manubrium, but if you hear that sound any other place of the lungs or chest cavity, it's an indication that there is a consolidation started or exists. Consolidation means normally there will be air filled spaces. In alveoli and all you can see air, but in that area you can see fluid. That is the indication of a bronchial breath sound other than manubrium. So if you hear it in the manubrium, okay, normal. So I told you tracheal breath sound, vesicular breath sound, bronchial breath sound, all are normal only. Then broncho-vesicular breath sound. Another fourth one is broncho-vesicular breath sound. They are you can hear over the main stem bronchi. Okay, you can hear over the bronchi. That's why broncho-vesicular. So these four things are normal sound. Okay, just note it. These are normal breath sound. Now we have to study some abnormal sound, like or adventitious breath sound, abnormal sound. So first one is coming crackles. So crackles, important, it's a non-musical sound. Crackles is a discontinuous non-musical sound. Okay, non-musical, very important, non-musical. Which one? Crackles. And it's not continuous, discontinuous. And crackles itself, we can tell that fine and coarse. Okay, fine and coarse. Okay, two type, fine or coarse. And if you hear crackles anywhere, it indicates fluid in the airspace. So this is the important point. So 2 point I can tell you. Crackles means it indicate fluid in the airspace. 1 point, and second point is non-musical sound. Crackles, non-musical sound, and it indicates there is a fluid in the airspace. So normally if the airspace where like alveoli, bronchus, all those areas there will be air, but instead of air if there is fluid. Okay, so the crackles indicate fluid in the airspace. It means that there is infection. It means that there is infection. So you can hear, you can see these things in pneumonia, pulmonary congestion, bronchiectasis, fibrosis, at least pneumonia. Okay, infection. So crackles. Three things I will tell you. One, in pneumonia you can see, then fluid in the airspace. Third one is non-musical sound. These three things you have to note. Okay. Okay. Now we are talking about abnormal breath sound. Okay, V6 or wheezing. You know what is this wheezes? Wheezes is a musical sound. Wheezes is a musical sound or whistling sound. Musical sound. Crackles is non-musical, but wheezing is a musical sound. It indicate, wheezing means it indicate narrowing of the airway, not complete obstruction, narrowing. So when there is a narrowing, if air is passing through that area, when air is passing through that area, there will be whistling sound or wheezing. Okay, you got this point. How in wheezing, wheezing indicate what? Because the airway is narrowed, now smaller. So when the air passes through this narrow area, there will be wheezing or whistling sound. Okay, example, In asthma, you can see wheezes. Okay. Before that, how these breath sounds are occurring? How these breath sounds are occurring? Simple. When air pass through your airway, when air is passed through your trachea, bronchus, bronchi, alveoli, so this will create some turbulence. This will create some turbulence. That sound you can hear by putting stethoscope. Simple. Okay. So wheezes you got, crackles you got. What is that? Stridor. Stridor is a vibratory sound. Stridor is a vibratory sound. This will occur when it's also musical sound, and this will occur when there is an obstruction, obstructed trachea or larynx. Like if there is any foreign body obstruction, if there is a foreign body obstruction. So in this case, you can see stridor. Stridor is a vibratory sound. So wheezing, narrowing, I told. In stridor, it's a musical sound, but it's a vibratory. See, stridor. When you say stridor, you can feel a vibration. No? So easily you can remember. Stridor is a vibratory sound. Then it suggests obstruction. It suggests obstruction, complete obstruction. So these three things, I think, clear. Crackles, wheezing, stridor. Crackles is non-musical sound. Wheezing, stridor, or are musical sound. So wheezing you can hear in asthma. Then stridor you can hear in some obstructions like foreign body obstruction and all. Then rhonchi. Rhonchi are heard in mixed issue, airway constriction and secretions. When there is airway problems and secretions, you can hear. It's a musical sound. Example, I can say you in bronchitis and COPD. Bronchitis and COPD, you can hear rhonchi. Rhonchi is a musical sound. It's just like a wheezing, but not that much like wheezing. Okay, but it's somewhat similar like a wheezing. So musical sound, rhonchi also musical sound. You can hear in bronchitis or COPD. Then tracheal rails or tracheal rails or death rattle. Another name is tracheal rails or death rattles. It is usually heard over tracheal rails. So the name itself tracheal. So you can hear over trachea, and you can hear this in mainly in ill patients who are unable to cough. So when there is lot of secretions accumulated, and in these ill patients, old patients, if they cannot cough properly, or cough and if they cannot remove their secretions, so in that patients you can hear tracheal rails. So again, I am just concluding all those things. Wheezing, stridor, rails, tracheal rails, rhonchi, crackles. So these are the abnormal breath sound. So you have to remember at least some conditions, like in tracheal rails means inpatient, rhonchia means in bronchitis people, wheezing means in asthma, then crackles means pneumonia, then stridor means foreign body obstruction. At least these points you should know, and all are musical sound except crackle. Crackles are non-musical sound, and other points like wheezing is a whistling type sound, stridor is a vibratory sound. Okay, so at least these points, because if you are planning to study the entire thing in detailed manner, you will not be able to remember these things. So for exam purpose, you remember these things. Again, I am telling you, when you study, for those students, I'm telling, when you study, we are focusing 4 important points. One is you have to complete your basic studies and important concept study. Then you have to practice more and more questions with the time management and negative mark systems. Then you have to do these MCQ discussions, or you have to attend the MCQ discussions and important core point discussion. So if you can do these 4 things properly, regularly, systematically, definitely you will be able to get or crack the central government job. It is not like you will study everything in detail, like you will take the book because a lot of students are doing these things, these mistakes, and they are complaining me that they are studying but they are not getting the selection because their study style is not good, it's not proper. It is not like you will study, you are not going to attend BSc nursing university exam or something. Here they will ask you multiple choice questions, so no need to explain all those things. You have to give them that proper or specific point, and we know that you do not have enough time to study everything in detail and to remember all those things. That's why I'm again and again telling these things, so please focus these things. Okay. A client with end-stage renal disease has opted for an AV fistula for long-term treatment with hemodialysis. If you can see the question like a big one, but it's not like that much a big question. So one client is having CRF, chronic renal failure, and we are going to put AV fistula. When will the client be able to use it for hemodialysis? So we are going to put AV fistula for a patient. When you can use this, when you can use these things, this fistula for hemodialysis. So you did this fistula, you put this fistula, when you can use. Please comment your answer. If it is wrong also, no problem. Please comment. AV fistula. Sharon is telling D 4 to 6 months. 4 to 6 months became long. Okay, Nagaveni is telling B, Anju is telling C. So the answer is 2 to 3 months. So Nagaveni is correct. It's 2 to 3 months. After 2 to 3 months, you can use AV fistula. So when you attend our mock test, when you attend our model test, you will be seeing these kind of questions. These kind of questions. So for our students, I told that one exam, one model exam or one online exam, that you have to practice 2 to 3 times, not one time or one time. First you will attend, then you will be getting your result, your wrong answer, right answer, how much mark you have got, all those things. After that also you have to attend again. After reviewing the answer, again you have to attend. So when you attend one exam 2 or 3 times, you will be able to remember these things. No need to go further. Just do the same question 2 to 3 times in exam mode. Definitely you will remember all those things. Otherwise what will happen? You will forget. So this is the tip of every day, every class we are giving tips, right? So the tip for today is, when you practice questions, when you practice model exams, I know it will be very boring for you practicing same exam again and again, but considering your selection, considering your exam, what you have to do, you have to practice it. You have to practice it properly. Okay, you have to practice it properly. Same question again and again. So you will take one exam for practicing and you will do that practice. After that you will check your score, you will check the answer, again you will practice same exam 1 or 2 times. So when you practice 2 or 3 times same exam, same questions, when if that questions or related questions are coming after 6 months, 4 months, 3 months, you will be able to remember. Otherwise what is happening? You are studying, but you are not able to remember. That's what happening when some people, they will tell that I finished 10,000 questions. Some people will tell I finished 10,000 questions. But if you cannot remember, you finish 10,000 questions, good. But if you cannot remember these 10,000 questions, you remember in the sense, if you cannot answer that questions again, if they are asking, or if you forget, example like this type of questions, if you forget, then there is no use of doing 10,000 questions. So if you do it in the exam mode or practice mode 2 to 3 times, definitely you will remember these things. So please follow these things. Because a lot of students, when they are thinking about preparation, they will buy some competitive exam books, they will read that questions, they will read that questions, or they will study that question one time or two, one time, like read, that's all. But when the exam will, when the, if sometimes the exam may be coming after 6 months, 4 months, that time if they are not able to remember that thing, so this is the mistake happening. Okay, so don't do that. Okay, this thing no need to explain and all. When taking the blood pressure, simple question, when taking the blood pressure of a client who is seated, which position must the client change so that the nurse can get an accurate measurement? So you are going to take the blood pressure of a patient, and patient is in a position. So as a nurse, sometimes you have to tell the patient, please change your position, don't sit like this, like that. Okay, so in which position you will tell the patient to change? Okay, suppose patient is sitting, lean the head back, then put down phone, sit up right, and uncross the legs. Again I will tell you the question, it's a simple question. Again I will tell you the question, which position must the client change? Which position must the client change? In these positions, I have given you 4 positions. In this, which position you have to tell the patient that please change this position so that I will get a accurate measurement. You got the point? I'm not asking you which position patient will get which in which position. So that's why I told you this is a easy question, but you may make mistake. Which position the client should change to get a proper measurement? All are telling C. C means sit up straight. Yeah, if you sit up straight, you will get a proper measurement. But question is that which position must the client? So in this, which position the patient should change, then the nurse will get a correct measurement of BP. If patient is sitting up straight, means you will tell the patient change your position? No, you will not tell, because that position is okay. So here one position is not good, which will give you false results. So which position? Now you got the point. So a lot of times what will happen, question will be very easy, but you will not read it properly, so that you may make mistake. So the answer will be D, leg crossing, because if you cross the leg, the blood circulation will not be properly. The circulation will not be properly. So that if you put the phone down, no problem. No, if you put the phone down, it will not affect your BP measurement. If you sit up straight, it will not affect your measurement. If you lean the head back, it will not affect your BP measurement. But if you cross the leg, what will happen? It will what will happen? It will, it will disturb the blood circulation, so that there will be a problem in the blood BP measure. Okay, so the answer will be D. Next question, A female patient complains of abdominal discomfort. Okay, no problem. Female patient complains of abdominal discomfort. Watery stool has been leaking from her rectum. So abdominal discomfort she is complaining, and now she is having watery stool has been leaking from her rectum. So okay, already I put the answer here, right? Yeah, okay, by mistake I have given the answer, sorry. Watery stool has been leaking from her rectum. This could be a sign of, okay, so already I have given the answer. Okay, anyway, we will discuss. So patient is having abdominal discomfort and watery stool. So we will check whether it will be a constipation. Constipation? No, in constipation means nothing will go outside. See, that's constipation. So constipation will not be. Then diarrhea. Diarrhea is not like leaking. No? Watery stool has been leaking. It's not like leaking. In bowel incontinence also, it will not be like that. So the answer will be fecal impaction. Fecal impaction means already there is a accumulation of stool inside the rectum or in the bowel. Then what will happen when that mass becomes stool mass become hard and more, then there will be leaking from the side. Okay, so watery stool has been leaking from her rectum. So it's a sign of fecal impaction, not a sign of diarrhea or constipation. In diarrhea, it's not like leaking or something, right? So the answer will be fecal impaction. If you do this question, okay, now you saw this question one time, okay, and if the exam is asking after 4 months or 3 months, you will not be able to remember. But if you see this question, or if you practice this question 2 to 3 times, definitely you will be able to remember this fecal. When you see this watery stool, then only you will give the answer of fecal impaction. You will not check for the other options also. Okay, so practice like this. The nurse is teaching the parents to instill eye drops for their 4-month-old daughter. Okay, so a nurse is teaching parents how to instill eye drops for their old daughter, 4-month-old daughter. Okay, so the parents tell the nurse that she shuts her eyes tightly to avoid the drops. So when you see here, it will be like a big question, but a very easy question only. The parents tell the nurse. Okay, so the parents telling the nurse that my daughter is always shut her eyes when we are putting the drops. So which instruction by the nurse is most appropriate? So as a nurse, what instruction you will give? The parents should, options are, the parents should wait until their daughter is relaxed. It's very difficult, no? The parents should wait until their daughter is relaxed. Second, parents should put the drops into the inner canthus. Third, the parents should instill the drops into the conjunctival sac. Fourth, the parents should open her eyes with a thumb and forefinger. So if you do not, the answer is clear, it's easy question only. And if you do not know the answer also, just see 4-month-old only, 4-month-old. So you cannot wait until the daughter is relaxed. So whenever you are trying to put the put the eye drops, the baby will become restless. So it's very difficult to that whether the to wait for the daughter to relax. So this will not be the answer. And the parents should open, last one I'm talking. Okay, the parents should open her eyes with a thumb and forefinger. So thumb, by using thumb and forefinger, you are opening your eyes of a 4-month daughter, means it's not a correct idea. So now we have options like parents should put the drops into the inner canthus, parents should instill the drops into the conjunctival sac. Which one you will give? Deepak Shah is telling B, Soumya is telling B. So I think the answer will be B, right? So yeah, the answer is B. So always, so the technique is that for small children, for all 4-month or children, you have to put the eye drops into the inner canthus. Just put the drops into the inner canthus. What is the inner canthus? If this is the eye, this area is called inner canthus. This is outer canthus. This is inner canthus. So when you put here, if the baby's eyes are closed, then also you put here the drops. So whenever baby open the eyes, that drops will go into the eyes. Okay, so put into the inner canthus, not the outer canthus, inner canthus. Very simple question, but when you see this type of questions, you will see it's like difficult or a lot of things to read like that. But when you read properly, when you read the question, read it properly. Like, see how I am reading. The nurse is teaching parents to instill eye drops. So understand the question. Okay, one nurse, simply you understand in mind. Okay, one nurse is going to instill eye drops. Okay, and parent tells. So all those things. Otherwise, when you read simply like this, so you may get confused. So understand the question properly. Always when you see this kind of lengthy question, think that the answer or the options will be very easily you can answer. A 10-year-old boy is admitted to pediatric unit with diagnosis of viral meningitis. So one 10-year boy admitted in hospital with viral meningitis. He is experiencing headache, stiff neck, vomiting, photophobia and drowsiness. Lot of things. Headache, stiff neck, vomiting, photophobia, but drowsiness. So it's meningitis. In meningitis, all those things are normal, right? In meningitis, not normal. All these things are the signs and symptoms. Headache, stiff neck, vomiting, photophobia, drowsiness. The nurse can make him more comfortable by. So how you will make the patient comfortable? You will close the shades and you will give dimming lights. Like if there is more sunlight or something coming into the room, you will close that thing and you will put only dim light. Or you will teach him deep breathing, or you will provide him with a large soft pillow, or you will encouraging him to drink fluids. So patient is having vomiting, headache, stiff neck, photophobia, drowsiness. So in viral meningitis, always the patient will be restless, right? Patient will be restless and patient is having headache, patient is having photophobia. So in this condition, what you will do? What will be the answer? Virendra is telling A. Yeah, closing the shades of dim and dimming lights. So you have to avoid irritation. You have to give a calm environment for this kind of patient. So you have to close the shade and you have to provide dim light. Deep breathing, giving large soft pillow, it is not related to this kind of things. Okay. So in viral meningitis, you have to study what is meningitis, then all the signs in the meningitis. That's all are important. It was a simple question, right? Of the following positions, which one facilitates maximum air exchange? Of the following positions, which one facilitates maximum air exchange? High Fowler's, Trendelenburg, lithotomy, orthopenic. Of the following positions, which one facilitate maximum air exchange? Telling High Fowler's, Sharon is High Fowler's, Soumya is telling High Fowler's, Nagabeni is telling High Fowler's. Virendra is telling D, orthopenic. So this kind of question, if you do not know the answer also, you can make it. I always tell you 50%, 50-50, like 50-50 you can make it, right? Like you know that Trendelenburg will not be and lithotomy will not be. Now you have confusion between High Fowler's and orthopenic. So this kind, so when you answer any question, you have to answer like that. Okay, B will not be the answer, C will not be the answer, I have doubt in A or D. So if your mind is saying A, give A. If your mind is saying D, give D. Okay, so that what will happen, you can avoid maximum mistake. If you put D, if you put A, so maximum mistake you can avoid, right? Because in any exam you will not be able to answer, or you will not be able to know the entire questions perfect answer. No, it's not possible. So there will be some questions you know the perfect answer, or you know the exact answer. Some, there will be some questions where you will be confused. So if you read the questions properly, you can eliminate some options so that you can answer more and more questions. So use this technique. So the answer will be D. Virendra's right answer will be D. Yes, in high fouls also patient will get maximum air. I mean, good. It's easy to do breathing, but maximum air in orthopenic. Orthopenic means sitting and leaning forward. Sitting and leaning forward. That is orthopenic. What is orthopenic? Breathing while sitting and leaning forward. Like in COPD and all, we will place the patient like that. Okay, so sitting and leaning forward, orthopenic. Okay, because when you see these questions, suddenly you will high fowler's position is giving for like that, we will think. But orthopenic, in orthopenic only we will facilitate maximum air exchange. Don't worry, we will learn. So now people are thinking, I have learned these things. I mean, breathing techniques, or I have learned respiratory system. Still, I am not able to answer. So you may be thinking like that. Don't worry, don't worry. See, like this we will study. You studied some concept, then you practice with the questions. Now you are again practicing, or now again you are studying with your um, core point discussions and MCQ discussions. So here also you will get lot of questions, lot of points. So all together definitely it will help you to to crack the exam. It's very easy. AIIMS NORCET you can crack easily if you follow this 4-step study. I hope you people are following this 4-step study, and Neuron Nursing Academy will help you to do this 4-step study. We know that you do not have a lot of time to study all the things in detail. So that's why we designed our class in such a way. Okay. A patient receiving chemotherapy is experiencing stomatitis. What is stomatitis? So if in stomatitis you can see there will be inflammation of your lip, tongue, all those things, right? Larynx. In stomatitis, I mean entire things I'm telling. So stomatitis, patient is receiving chemotherapy and experiencing stomatitis. Which of the following should the healthcare provider offer the patient? So if your patient is having stomatitis, especially in chemotherapy, what you will do? You will options A, hot soup for lunch and dinner. Will you give hot soup for lunch and dinner? This is the option A. Option B, warm saline rinses 4 times each day. You will give warm saline to rinse the mouth 4 times each day. And C, vigorous oral care with commercial mouthwash. And D, plenty of ice chips between meals. Okay, so I'm telling infection and inflammation of the mouth, stomatitis. Yes. So if there is stomatitis, what you will give? You will give hot soup. So I'm going to answer hot soup. Never. I will not give hot soup because patient is having stomatitis. Warm saline. Yes, warm saline I can give. It's good. Vigorous oral care with a commercial mouthwash. I cannot give vigorous oral care. So this will not be the answer. Plenty of ice chips between meals. I have confusion because I am not an expert in this thing, but I think that if I can give plenty of ice chips between meals, it's okay. I'm thinking like that. I'm thinking like that. You may think like that. So now you have option B or D. So better option is warm saline rinses 4 times each day. Plenty of ice chips I cannot give. Ice will give. It's cold, so there will be more reason for infection and or inflammation. Already inflammation is there, so I cannot give more and more cold things. So I will go for warm saline because patient is having infection, so there will be problem in taste and all those things. So I have to give warm saline to avoid or reduce infection. So it's an easy question. When a patient NG tube stops draining, what is the nurse's first action? So there is an NG tube and it stopped draining. What is the nurse first action? I've already put the answer. Clamp for 1 hour, instill 50 ml of water, retract 2 inches, check tube replacement. We will never clamp NG tube. We will never clamp NG tube. And instill 50 ml of water, it's not a proper way. Then retract 2 inches, no. Check the tube placement always before and after, before giving any NG tube feeding, or if the NG tube stop drainage, what you have to do? You have to check the tube placement, whether the tube is in the proper position or not. The healthcare provider is preparing a patient for a total colectomy. So you have one patient. Patient had total colectomy and the placement of an ileostomy. So total colectomy. What is total colectomy? Removal of the colon. Okay. Removal of the colon. That is total colectomy. And the placement of an ileostomy. After total colectomy, we did a ileostomy. The patient asked where the stoma will be located. Okay, so you are going to the patient is asking. Okay, we are taking a patient for a total colectomy and ileostomy. So patient is asking where this colectomy or the ileostomy will be, or the stoma. Stoma will be located. So the healthcare provider identifies which of the following area as the correct stoma site. So after colectomy, and you are placed an ileostomy in a patient. So where you can see this ileum, it's in the right lower quadrant of the abdomen, left lower quadrant of the abdomen, right upper quadrant of the abdomen, left upper quadrant of the abdomen. Answer will be A. Answer will be A. C. Total colectomy means removal of the large intestine. Okay. You can see this kind of stoma. The gastrointestinal output will occur. When you are doing a terminal and ileostomy. Ileostomy you are doing means you will making opening in the ileum also, from where the gastrointestinal output or stool will come. So this stoma will be located in the right lower quadrant of the abdomen. Right lower quadrant of the abdomen. You can see the opening or the stoma. You can see on the right lower quadrant of the abdomen. Simple question. Let's see you will answer or not. A client comes to the clinic complaining of severe gastrointestinal distress, which abdominal physical assessment step does the nurse do first? A patient came to the clinic and complaining of gastrointestinal distress. Which abdominal physical assessment step does the nurse do first? Easy question. Very easy question. Okay, all are giving correct answer. Answer is A, inspection. So when this question will come, people will make mistake, like they know that okay, in abdominal examination, the sequence is different. Like normally there is a sequence, no? Inspection, palpation, percussion, auscultation. Inspection, palpation, percussion, auscultation. There is a sequence. But in abdominal assessment, the inspection is different. So when they saw this question, they will tell, oh, the sequence is different. Then they will put percussion or palpation as a right answer, because they think, oh, this is the sequence is different. But the sequence is different, but still they have asked the first sequence. First step only they have asked. First step always inspection. Okay, if you know this sequence, okay, for abdominal physical assessment, what is the sequence? Inspection, auscultation, percussion, then palpation. But always what is coming? Inspection is coming. So the answer is inspection. Okay, so in abdominal and in other place, in other area, when you do physical assessment, the sequence is that inspection, palpation, percussion, and auscultation. But in abdominal, when you do the assessment, the sequence is inspection, auscultation, percussion, palpation, because we will do auscultation after inspection. Otherwise, what will happen? The bowel sound will change. Okay, simple question, but people used to make mistake. Contraindications for administering an enema include all of the following except. So 4 option is there. In this, one is not an contraindication of enema administration. Contraindications for administering an enema include all of the following except acute myocardial infarction, suspected appendicitis, recent colon surgery, hypercalcemia treatment. So you cannot give enema in all these conditions except one condition you can give. In which condition you can give enema? Please give the answer. If it is wrong also, no problem. Give your answer, no problem. We all are not perfect. We all are having defect. We all are having defect. No problem. By doing mistake, we will become perfect. Here I am not asking you contraindications of enema. I am asking you I have given 4 options, all telling that except one, all other are contraindications. Except one, all other are contraindications. So the question is that contraindication of enema include all the following, but except one. So which one will not be the contraindication of enema? Acute myocardial infarction is a contraindication. It's a contraindication because when you give enema, it will create abdominal pressure, increase abdominal pressure, so that you cannot give in acute myocardial infarction. So this is a contraindication. Correct. In appendicitis also, suspect appendicitis also, you cannot give enema. And reason, you had a colon surgery reason, so you can't give enema. It's a contraindicated. But in hypercalcemia treatment, you can give. So this is the answer. You can give. This is not a contraindication. This is not a contraindication of enema. This is not a contraindication of enema. Hypocalcemia. Hypocalcemia is a contraindication. Hypocalcemia is a contraindication for enema. If patient is having hypocalcemia, you have to be cautious for giving enema, because there will be some exchange between calcium phosphate, sodium phosphate, calcium phosphate, all those things. Okay, so in hypocalcemia you have to be very careful in giving enema. So hypercalcemia, no problem, you can give enema. Okay, so this kind of questions, now you learn, but you may forget. But if you are practicing this kind of questions 1 or 2 times, I know it will take more time. You must have that patience. Take more time. Do that thing again and again, 2 or 3 times. Definitely you will be able to answer this kind of questions. No need to go into details or something. Just contraindication you will give. Okay, hypercalcemia you can give. Hypocalcemia you cannot give. So now you learned 4 points from that. What are the contraindications of enema? In acute myocardial infarction we will not give. Suspected appendicitis we will not give enema. In recent colon surgery we will not give enema. In hypocalcemia also we will not give enema. But in hypercalcemia you can give enema. Okay, so the answer is D. This is also important, very important question. A client returns to the unit after abdominal surgery. So one patient had abdominal surgery. After that, while monitoring the client, the nurse observed a moderate amount of red blood on the dressing. So after surgery, when the nurse was observing, then she saw a red blood on the dressing. The nurse will document this type of wound drainage as. What type of wound drainage is this one? Serosanginous, sanginous, purulent, or serous? Bright red. You saw bright red. You saw bright red color or red blood on the dressing. Red blood. There is no white color. There is no any other type of mixing or anything. Only red blood. So how you will document this thing? Very important. Many times this kind of questions they have asked. Sharon is telling D. Nagaveni is telling D. Shalani Shukla is telling A. Ranjita is telling A. Soumya is telling B. Pragadika is telling A. No problem. We will learn. Okay. So the answer is sanginous. Okay. Here we will discuss. I told you one is serous. Serum or serous. Serous means clear and thin. Clear fluid. Okay. Clear type of. That is serous. Clear. If you see clear drainage, it indicates that the wound is healthy, is healing, no problem. Okay, serous means. Serosanginous means it is containing blood. It is containing blood plus serous, means there are some clear fluid plus blood. Serous means always, what is the meaning? Serous means clear one. Okay, serosanginous means blood plus some clear fluid. Sanginous means only blood. Okay, sanginous means only blood. It came from a Latin word. Okay, it came from a Latin word meaning blood. Sanginous means blood. Serum means clear. Okay, you got. So you have to understand only two things. Serous means clear, sanguineous means blood. Serosanguineous means blood plus clear fluid. Okay, means there is a mixing of two fluid. There was some leakage of like thin clear fluid, and there will be blood. In sanguineous, only blood. Purulent means thick white pus like. Okay, if there is a thick white pus like drainage, we will call it as purulent. When you see purulent drainage, it's an indication of infection. Okay, indication of infection. So now as a nurse, when you see the drainage after surgery, when you are checking the dressing, when you see the drainage, easily you will tell this is serous or serosanguineous or sanguineous or purulent. If you see like a clear fluid, some you can see some type of stain like, but there will not be any blood or anything. Clear fluid means you will tell it's a serous. But if you see kind of clear fluid plus some blood stain, you will tell serosanguineous. If only blood means sanguineous. Purulent means white type of pus like drainage, purulent. Okay, same way. Now you know the drainage, what type of drainage, and the amount also. You have to mention the amount. In the mention the amount means when you see this kind of drainage, you cannot you will see this kind of drainage on the dressing. On the dressing you will see the drainage. So you cannot tell that the amount like 200 ml, 500 ml, 300 ml, like that you cannot say, because you cannot measure that thing. So for that, how you will tell? If there is no drainage or anything, you will tell none. Okay, but if you see a little drainage, moist, the wound is moist, you are checking the wound area, there is a dressing is there, and on the dressing you see some moist wound, and there is no drainage, proper drainage or not there, but there is some type of moist is there. So you will tell scant or scanty drainage, scant. If you see 25% or less of dressing, you see a drainage, and the drainage is 25% or less, means you will tell small or minimal. If you see up to 50%, so you are checking the dressing, there is a dressing, there was a wound and there is a dressing, and over the dressing when you see 50%, up to 50% of the dressing has drainage, then you will tell moderate, up to 50%. Okay, if it is more than 50%, you will tell a large or copious, so when you check a dressing, there may be leakage of blood or serous, sanguineous, all those things. So you have to document it. First you will document whether it is serous, sanguineous, serosanguineous or purulent. Then you have to give the amount. If there is no leaking or something, means you will tell none. But if there is some type of wound, moist, the dressing is somewhat moist, means you will tell scanty or scant. If 25% or below the dressing has having drainage, means you will tell minimal or small amount. Up to 50% you will tell moderate amount of drainage was there or bleeding was there. If it is more than 50%, you will tell large or copious. Okay, the nurse is providing post-mortem care for a client who was being treated for a Staphylococcus aureus. So one patient had a Staphylococcus aureus infection, and now the patient died. Okay, so now you are doing the post-mortem care. Which transmission based precaution are indicated? So what type of precaution you have to take? What type of precaution you have to take for a Staphylococcus aureus infection? Patient already died, you are doing post-mortem care. What kind of? You have to take droplet precaution, you have to take airborne precaution, you have to take contact precaution, or you have to take standard precaution. Give your answer. If it is wrong also, no problem. We are learning only. We people are not perfect. We are learning only. Okay, the answer is C, contact precautions. The answer is C, contact precautions. C, Staphylococcus aureus, or I can say it's methicillin resistant Staphylococcus aureus, MRSA. MRSA. What is the full form of MRSA? One time this question have asked. Methicillin resistant Staphylococcus aureus. Methicillin resistant Staphylococcus aureus, and this is transmitted by contact. This is transmitted by contact, and normally this bacteria may live up to 3 days. Live up to 3 days. Even the patient is dying also, it may live for 3 days, and it is transmitted by contact. So methicillin, MRSA, contact precaution. So you have to put a gown, gloves, all those things. Okay. The Wong-Baker-Faces pain rating scale. You know what is Wong-Baker-Faces pain rating scale? You are using in hospitals, right? Can be used by all of the following except. So Wong-Baker-Faces pain scale can be used in all the condition except. First one, parents and caregivers. Can you give this to parents and caregivers? Wong-Baker-Faces pain scale. Or can you give to children ages 3 and older? Or can you give to non-English speakers? And can you use it in mentally disabled adults? What will be the answer? Wong-Baker-Faces, in which condition you can give except. So in this thing, in this 4 option, 3 option you can use for use for Wong-Baker-Faces pain rating scale. But in one option you cannot use it. What will be the answer? Option C, non-English speakers. No. Ranjita is telling D. Ranjita is telling D. Deepak is telling C. Soumya is telling D. Sharon is telling B. C. You can use the first I will tell you the answer. The answer is parents and caregivers. Parents and caregivers. In parents and caregivers, you can't use it. You cannot give it because see, this is Wong-Baker-Faces pain rating scale. You may be seeing this thing in hospital settings. Wong-Baker-Faces pain rating scale, because when in some situations we will ask the patient how much you are, can you explain your pain from 0 to 10. From 0 to 10, can you explain your pain? But in some situation you cannot explain this thing to patient, because patient, if small child, can you tell the patient, can you tell the child that okay, please tell me how much pain you are experiencing from 0 to 10, can you tell me, like that? Can you ask for a child? No, you cannot ask for a child because it's a child. Alright, so in that situation we will check the patient face, and from the face we will understand how much severity or severe pain patient is experiencing. Like if you see the picture, if the patient face is like this, means 0. If the patient face is like this, means it's 10. So the starting point is 0 and 10 is the maximum score. 10 means the patient is experiencing maximum pain. 0 means no pain. 10 is the worst pain. And again 1 to 3, uh, 1 to 3 like mild, then 4 to 7 is moderate, then 7 to 9 10 is severe. Like that also you can categorize. But this question, sometimes they will see give you this picture, and in image based they will ask you what kind of, or what kind of rating scale or name of this rating scale. So you have to give Wong Baker Faces Pain Rating Scale. This is used for rating the pain. And two people, one man name is Wong and the other one is Baker. Wong and Baker together, they constructed this kind of pain rating scale, Wong and Baker. So this picture is for pain rating scale. Then pain rating scale, see, you can use in children, right? You can use it children ages 3 and older. In children, because children cannot understand what you are telling. Non-English speakers also, suppose non-English speakers, in the sense, if you are in another country, there only English is, only English. This question is from the N class, that's why they put non-English. For non-English speakers, or if in India, you can say that if the patient doesn't know Hindi and you are explaining in Hindi, or you are explaining in your mother tongue, and the patient cannot understand your language, so then also you can use this pain rating scale. And in mentally disabled adults also, if you ask them, if you explain them, tell me your severity of pain, they will not be able to understand. So you can use okay. But in parents and caregivers, how they can, by looking at this scale, how we can, looking at the parent and caregivers, or asking with the parent and caregiver, how you can assess the pain scale or severity of pain of a patient. Patient's pain is subjective. That patient only can tell how much pain I am experiencing, not parents or caregivers. So you cannot use this for parents and caregivers, or you cannot ask this for parents and caregivers. The answer is A. Okay. A client has a pressure ulcer on the sacrum. Okay. Client is having pressure ulcer. Okay, I already put the answer here, right? Put the answer. Okay. I think you saw this answer. Okay, no problem. A client has a pressure ulcer on the sacrum. While assessing it, the nurse observed that it has a partial thickness, loss of dermis, and a red-pink wound bed. Which stage will the nurse assign this pressure ulcer? So it's an important topic, pressure ulcer. So I will tell you some stages of pressure ulcer. Whenever you get time, please read these topics. Okay, stages of pressure ulcer, then stages of wound healing, okay, all those things, stages of pressure ulcer, stages of wound healing, like that you have to study. Okay, the important points, important things, like that you have to study. Stages of pressure ulcer, stages of wound healing, you have to study. Okay, so here they told that where there is a loss of partial thickness. Okay, partial thickness, you know what is pressure ulcer, right? Decapitated ulcer or pressure ulcer. Please repeat the rationale of last question. I couldn't understand. Sharon is telling you couldn't understand. Okay. Okay, you are. I think you are asking about this question. Wong Baker Faces Pain Rating Scale can be used by all of the following. So, in which condition? So there are 4 conditions I have given you. In 3 conditions you can use Wong Baker Faces, but in 1 condition you cannot use Wong Baker condition. That was the question. So, in which conditions and all you can use? Children ages 3 and older, you can use children, because in children, especially in children, you cannot use you cannot, if you ask the patient about your pain scale. Pain scale means how you will ask. You will ask how much severe pain you are experiencing. Like that you will ask. Tell me from 0 to 10. For old people we can ask, or adult we can ask, but for a child you cannot ask them, please explain your pain. We cannot ask them. So by looking at their face, okay, I have show you one picture here, which is the, okay, by looking at this, if you see this picture, if the child face is similar to any of this picture, means we will give that type of score. If the child face is somewhat like this, we will tell that patient is failing, the pain scale is 10, like that we will tell. Okay, so in children you can use this Wong-Becker faces. In non-English speaker means, if it means that if the patient cannot understand your language, that's what non-English speaker, because this took from Nicholas question, so they put non-English as a option. But in Indian setup, if I can say, if the patient cannot understand your language, okay, so then also you can use Wong-Becker faces scale to identify their pain scale or pain rate. And in mentally disabled adults also, you can they cannot explain what they are feeling, so by looking at their face you can rate their pain scale. But here they have given parents and caregivers. Parents and caregivers means, you know, if you cannot ask patients pain, about patient's pain, to a parent or to a caregiver, because parent or caregiver cannot give exact idea about the patient pain. The pain is subjective, only patient can experience. So one thing you can do, you can ask the patient, or by looking at their face you can rate their pain. So asking parents and caregivers about the pain rating scale, it's not a like use of a Wong-Becker. Wong-Becker faces pain rating scale you should use directly with the patient, not with the parents and caregivers. Hope you understood, Sharon. Okay, so this question was regarding pressure ulcer. So what stages of pressure ulcer is this one? Here loss of dermis is there, and you can see a red pink wound and partial thickness. There is a loss of partial thickness and loss of dermis. Then you can see a red pink wound bed. So what kind of stage is this one? Here no subcutaneous tissue, muscle, tender, anything affected. Only the dermis is affected. So not a superficial loss. Sorry, full thickness loss. Only partial thickness is affected. So what will be the answer? This is an important one. You have to study these kind of questions. So 80% of the question or 50% of the topics which they ask in the exam, you will be having some idea. You can answer. So easily you can get. Okay. Before that, the answer is B. Okay. The answer is B. That means stage 2. Okay. See, I will show you the picture first. So this is a stages of pressure sore. Stages of pressure sore. In stage 1, you can see that only the epidermis is affected. And you cannot see any type of wound. Only red end or erythema you can see. Only red end or erythema you can see. Right? But when it comes to stage 2, your epidermis and dermis are affected. And when it comes to stage 3, you can see both epidermis, dermis, then subcutaneous tissue. Okay, this is subcutaneous. Okay, subcutaneous tissue. And when it comes to stage 4, all the things, the dermis, epidermis, subcutaneous, then you can see the bone, tendon, all those things. That is stage 4. See here. So you saw the picture. So like you can take a screenshot of this one. Okay. Stage 1 means skin is intact. There is no bleeding or you cannot see any injury. Skin is intact and it is reddened. You can see erythema reddened. That is stage 1 of the pressure sore. But if you see a partial thickness or loss of dermis, if there is a loss of dermis, partial thickness and loss of dermis, then we can say stage 2. Okay, stage 2. In stage 3, there will be dermis, epidermis, everything has gone, and now you can see subcutaneous tissue. So more deep. Now till subcutaneous tissue there is a problem. So stage 3. In stage 4 means your dermis, epidermis, subcutaneous tissue all affected. Now you can see the muscle or bone or tendons. This is stage 4. Again, here only a slight discoloration, reddened discoloration, reddened color. Here your dermis is affected. Here your dermis, epidermis is affected. Now you can see this is reached till your subcutaneous tissue. Here subcutaneous tissue, dermis, epidermis all affected. Now you can see a bone or tendon or muscle. Okay, so this is the different stages of pressure sore. After emptying a Jackson-Pratt drainage bulb, Jackson-Pratt drainage bulb, very important. How does the nurse re-establish negative pressure in the system? After emptying a Jackson-Pratt drainage bulb, how does the nurse re-establish negative pressure in the system? Options: fill the bulb with sterile saline solution, open the valve and fill the bulb with air, compress the bulb and close the valve, place the bulb lower than the client's body. So you should know what is Jackson-Pratt drainage bulb. You should know how it is working. What is the principle behind Jackson-Pratt drainage bulb? Is it working by using gravity, or is it working by using suction, or is it by using the negative pressure? You should know all those things. Not in detail, but at least some ideas. And you should know the image, because sometimes they will show you in image based question this thing, and you have to identify what is that. So Soumya is telling for this question. No, I don't know. Give the answer if you know the answer. Give the answer. So the answer is C. Compress the bulb and close the valve. Compress the bulb and close the valve. If I tell you like this, you will not be able to understand. I will tell you. This is Jackson-Pratt drainage bulb. Okay. I'll show you one more. So this is a bulb. You know, here you will collect the drainage. Okay. This is a tube. Drainage. This is a tube. Okay. And this will be fixed inside the patient body. Okay, or the wound, and this tube will be connected with a bulb. Okay, this is Jackson-Pratt. See, you can see here there is a wound. This is a wound, and they put the tube here, and the tube is connected with the this is called a Jackson-Pratt drain or drain bulb. So normally this bulb, so here there will be negative pressure. You will press this one, or compress this one, so that there will be negative pressure. So by using negative pressure, from here the drainage or all the drainage will come here. So the drainage will come here because of the negative pressure. So the principle here using is negative pressure. Okay, negative pressure. So you will compress or press the bulb, or this, you know, you can see this balloon type. Okay? This one you will press, so that what will happen, the drainage will come to the you know, the bag, the bulb. Okay, so now you know the image, you know. and how it is work. It is not working by gravity or suction or something. Okay, so it is not like filling the bulb with sterile solution. No, it is not. You are opening the valve and filling with air. No, what you will do, you will compress the bulb and close the valve. Compress the bulb and close the valve. So C is the answer. The D option, they told that place the bulb lower than the client's body, means by using gravity. No, Jackson Pratt is not working by using gravity. So no, not this one. This is you working by using the negative pressure principle. So compress the bulb and close the valve. Okay, so that you can create a negative pressure inside, or you can re-establish negative pressure inside the that bulb, so that drainage will start to come from the wound. Okay, so we are going to stop this class because almost to 1.5 hours. We will not take lengthy. I already told you that we will not take lengthy video class. So this was fundamental of nursing, third class. Again, we will discuss a lot of questions in the next video class. I will be updating you regarding the time and date of the classes. So please be if you are available, please attend these classes. It will definitely help you. So again, thank you from Neuron Academy. Those people who would like to attend our online coaching, if you or your friends or senior colleagues, whatever it is, kindly WhatsApp me on 73561828880, or you can visit our website www.neuronnursingacademy.com. Okay, so again I'm telling you, please go and study. Don't be tensed. Relax, study in a proper manner so that you will get. It is not like that. Okay, some people are there, before 1 week they will start to study, or they will take the books and they will study from here, there, here. No, relax. It's a promise from Neuron Academy. If you follow these 4 steps, definitely you will get job. Definitely, I can write and give you. Again, I'm telling you, first one, study the important basic concept properly. If you are studying 1 page, study it properly. Don't go in detailed manner, but you should know the concept. You should know the important points. So basic concept first. Second, you have to practice subject-wise exams. Then third, you have to practice model exams. Lot of model exams you have to practice. Then fourth one, you have to attend any MCQ discussions or core points discussions. So whenever you are learning more and more, means after completing this basic concept and all, then when you see some more questions, you will be having some doubts. That time you have to study about that thing. So we are learning together like this. You have to continue your study. By doing these 4 steps, you will be in central government. Those people who would like to join our online coaching, they can join. We are providing complete coaching. The course fee is 3,500. We will not give you lengthy video class. We will not, because we understand you. We know how much time you are having, how much you can read, how much you can reproduce or remember. We know all those things, and we will help you to prepare properly for a central government exam. And definitely you will get the selection if you follow our guidance. Definitely you will get. For 1 year you will get. The validity of this coaching is 1 year. So you will get all the video classes, study material, online exams for practicing, then core discussion point classes, everything for just rupees 3,500, and you can use it for 1 year, and you can study at any time. Our classes are recorded and uploaded in the website. So whenever you are free, open the website, study it, watch the classes again and again, attend the exam, unlimited time, and you will get all the answer, rank, everything with the negative mark system, everything. Okay, so by using your limited time, properly you can study, you will get. So do not be tensed or anything. Exam is going to come. You are studying. I know you people are studying very well. Do your study at least from today till AIIMS continually. You have to do that continually. Don't stop it anywhere. Just do it properly. Don't get tensed or something by looking at maybe your friend has got selection, or maybe your friend is studying more, or maybe he is telling more and more complicated topics, or telling some answers. Don't worry, don't worry. See, central government exam, you have to study. You should have some knowledge. At the same time, so by using some simple techniques also for studying, for answering, you will be able to answer. Okay, we will be helping you in all those things. Thank you for attending. Next class um, we will be informing you through our WhatsApp. Please join our WhatsApp group. To join our WhatsApp group, maybe you already in the WhatsApp group. WhatsApp us. Okay, appreciating all of you for attending this class. Thank you very much.